I'm just being mindful of the time at 6:05, and I do have one more question, but I think I'd prefer to keep that in my back pocket and kind of open it up to the floor now. So just start off by once again saying big thank you to you three, and then turning it over to the audience. If there are any questions for the group as a whole, or any of our panelists like in particular, feel free to pop those in the chat, either in general or directly to me. And we're a pretty small group, so if you'd rather just raise your hand or wave, I can try to keep an eye on that, and you can unmute too. But we'd love to hear from you. And these questions don't have to be what we talked about thus far. So if there's anything we really missed or that you want to hear from that we haven't covered, please do feel free to ask.
I can ask a question. First of all, it was a great panel. And Francine, you were talking a little bit about men and their access to children. I encounter this a lot in my therapy practice. I know Dave was on here as well, and it's actually a very common thing. I often feel very stuck in how to guide and support men with this, not being sort of privy to the legal side of things and what their legal rights are and so forth. And so what sort of advice do you have for clinicians who encounter this usually on a daily basis in supporting men around this particular issue?
Yeah, thanks, John. That's a really challenging question. I think I feel like I don't have a good answer to this, just because there are so many barriers for men to access services. And again, I think a lot of those, were put in place initially to, as a protective effort to support mothers, or to primarily support mothers. What I would say in terms of my experience with working with providers on the ground, and again, this is in like a very small geographic context, was that the providers did want to support the fathers, and they often did, even though it sort of went against the mandates of their organization. There were so many issues where, like a single father didn't have access to housing priorities, even though, he was, parenting a young child, because there was housing priority for mothers and children. But I think the folks that are working on the ground are doing their best, within the constraints of those policies and practices. In terms of, practical advice for you as a clinician, John, I don't know that I have any. I feel like I need your advice on this. Yeah.
Well, it's tough. I see so many men who are just shattered. They're broken because they are denied access to their children. Often it's because their partners, for whatever, demand that they don't get access or it's supervised, and they just concede to it rather than fighting for their rights. And I see some really shitty situations, and I often feel very helpless. And the way I try to get around it is, we do the work together in the therapy room to become the best version of himself, really, not only for himself, but to be the best dad that he can, when that access comes, and reminding them that being a parent never ends. So sometimes, I'll get guys come in, their kids are in their late teens, and they say, "Oh, I've only a couple years left, and I don't want to lose this opportunity." But I said, just because they turn 18 doesn't mean you stop being a dad. And
Right.
so you try to broaden their perspective a little bit. Sometimes that time point is so far away, you know, when the children are young, so it's harder for them to accept that, and I totally get it. So usually if the children are older, I said, you know, when the children are on their own, then you can develop whatever relationship you would like or wish for with your children, and those parameters that are in place, you know, while they're still with the ex-partner, aren't barriers any longer. But you know, we try to do the best we can, but it honestly, it's tough.
Yeah.
Yeah, you see a lot of injustices, you know, and I know there's always two sides to a story, and I'm getting one side, but sometimes it's pretty clear that, you know, they're getting the shaft, and I don't know what to do.
Yeah.
That's a tough first question, and also a
Sorry,
very-
but yeah,
thanks,
well, that's
John.
the reality. No,
No.
it's okay. I didn't expect you to necessarily have a magic solution, but you know, that's, you know, boots on the ground kind of issues that we have to deal with.
Yeah, totally. And an even tougher situation in real life or clinical practice for sure. It's an important question, even if it's tough. And I'm wondering, Sarah or Jennifer, did you want to add anything to that, or?
No, I was glad that question was directed towards Francine. It's a hard one.
Yeah. Great. Thank you. And we do have another one from the other John O in the chat, and I can read this one aloud. So it's, we as a group or a cluster or the world, who knows, have been interviewing men worldwide about equitable intimate relationships, but many guys instead talk to equality. What advice do you have regarding the language of equity and equality, and how men may take that up? Great question. Who wants to go first with that?
I could attempt to answer that. I guess I always think about equality and equity as alternative words of talking about sameness and fairness. So equality is where everybody is given the same resources, even though some may benefit more from that than others. Whereas equity is about giving out resources in a fair distribution, but that means that some may receive more than others. So it's not the same, but it's fairer. And I think it comes down to that acknowledgement, you know, that men are not all the same. Men are not this one single homogenous group. You know, they're diverse, as are women, and that diversity needs to be acknowledged in terms of how we share resources. So we might either share them in a way where everybody gets the same, or we share them in a way where everybody shares in the fairness of it.
Awesome, thank you. And Francine and Jennifer, would you like to add anything?
I also think of it in terms of sameness and fairness. I was thinking it feels a little bit like a difficult question. So we in our work don't use those words typically. So we sort of refrain from talking about equity and equality at all. I don't know that that means that we should avoid it, but just out of concern that the men that we're working with might not respond to that in systems and structures that are highly patriarchal. So instead we talk about like healthy families, you know, focus on communication, power and communication. So we sort of get at things in a different way. It's less structural. I'm talking about, you know, therapy with couples or with family systems. But it's interesting, you know, this language of equity and equality. And I'd love to hear from John Moore sometime what they're hearing and what people are saying.
Yeah, I would say, you know, just echoing those comments, I don't really have much more to add. I think, equity is central to the research that I'm engaged with. I think, with International Women's Day, the hashtag this year is Embrace Equity. So I think it's, a very, very timely question and approach. I guess just thinking sort of about in terms of equity within my work, I think equity, advocating for equity is a really important thing that I would note too. And, when we're thinking about International Women's Day, oftentimes it's, we need, men to advocate for women and transgender and gender folks as well. But also, in the work that I've done, I think the progress that we've really made is that it has been the mothers that have been advocating for equity for the fathers. So I think a big part of the language around, equity is focusing on who is sort of advocating for equity and how they're advocating. I think sort of bringing that into the discussions as well. And I echo what Jennifer said. I'd love to hear more from the research findings from John's work.
I love that comment about the how we're taking it up or even considering these issues, and then Jennifer's point too about context is key. Thank you. And then we have another question in the chat from Matt. So I can read this one out loud too. So I loved how this conversation touched on how addressing men's health inequities also addresses health inequities with partners, families, and in the community. Do any of you have any experience translating this to policymakers so that they understand and are willing to support men's health for its broader impact? Good question.
That's an excellent question. I can go first. The work that we're doing in Mozambique is in collaboration with policymakers and specifically with the Ministry of Health. So from the start, the inception of the project, we apply for funding together and we really do everything side by side. And they are able to take what we try in different communities and scale it up. So this work that we're doing with men and with partners to reduce violence, if effective, it can be something that could be implemented on a national scale. So it's, about buy-in and engagement and really working as partners throughout the whole process. The other thing that we're doing in New York with the Mental Wellness Equity Center is in partnership with the state. The focus is not so specifically on men's mental health. Of course, men are a part of that, but it is about equitable access to care and offering care in community settings and being creative about how we do that. So that too, it was interesting how that partnership started because it actually started through qualitative research. And through qualitative research, we were able to talk about this model that we had in Mozambique. We're thinking about bringing it to New York City and asking key informants who were policymakers what their thoughts were about that, how, financially could it work? Could we have, Medicaid and social services compensate for people who aren't specialized in mental health care and its delivery? And that process engaged and started a partnership with, now we're piloting this program in a few clinics in New York City, but the idea is if it works that we can scale up across the state, and we're in conversations with people who do mental health first aid, and already we're talking about who on the policy side do we want to involve. So we're always thinking about it, and really as much as we can involve people from the start, the best buy-in and traction we have.
Amazing, thank you. And I like the attention towards promoting men's interest, engagement, and uptake of interventions, but also policy buy-in as well, and right from the get-go. So thank you. Francine or Sarah, did either of you want to add anything there?
Sure. I would just add some of the work that we've done. I had a graduate student, Jessica Webb, who was actually a former service provider in the downtown east side and worked in that context for 10 years and then did a master's. And John and I were involved in some work with her. And one of her master's thesis papers was basically a policy analysis of family-centered programs in the downtown east side. And I, sort of briefly alluded to that. And one of the things that we did was we looked at 12 family-centered programs and assessed, if and how fathers were included or excluded within those policies and mandates. So we did, it didn't obviously go to, the federal level of, policymakers, but we did send this to the various organizations that were involved with our research to sort of highlight the ways in which, fathers were excluded. And again, how this sort of in a lot of cases undermined like the work of mothers that they were trying to focus on. So, that was our effort on a very, again, small scale to impact the organizational policies that existed.